Hello friends, so we are back with a new topic and our today's topic of discussion is tongue thrusting. Bouch in 1963 explained the tongue thrusting as a thrusting of tongue between anterior teeth, especially in the initial stage of swallowing.
This picture is depicting the clinical feature of the tongue thrusting.
Then Prophet has classified the tongue thrusting into four categories: physiologic, habitual, functional, and anatomical. Physiological tongue thrusting, which occurs during infancy, where all the perioral muscles are active and helps in swallowing with forward thrust of the tongue. Then the habitual tongue thrusting, because of the associated habit. Then the functional tongue thrusting, because of the adaptive behavior. And then the anatomic tongue thrusting, because of the enlarged tongue or large adenoids. Then Moyers in 1955 classified the thrusting into simple, complex, and retained. Simple tongue thrusting is also known as tooth together tongue thrusting or tooth together swallow, which is associated with the digit habit. Then the complex tongue thrusting, which is teeth apart swallow and associated with the hyperactivity of the perioral muscles. Then the retained tongue thrusting, because of the transition period from infancy to adulthood. There are two types of tongue thrusting, anterior and posterior. Coming to the etiology of tongue thrusting. First is if the infantile swallow is retained in the adulthood period, upper respiratory tract infection, neurological disturbance, and sometimes it is induced because of the oral habit, and then enlarged tonsil and adenoids, then sometimes genetic factor, and then in case of mixed dentition, and then in case of allergies. Now coming to the treatment part, first is exercise. In exercise, we have one elastic swallow. A 5 by 16 inch of elastic is put on the tip of the tongue, and the patient is asked to touch the posterior part of the incisive papilla with the tip of the tongue. Second is tongue hold exercise. The patient is asked to hold the tongue at the tip of the papilla for 5 minutes, and then gradually the time will increase up to 1 hour. Then there are other exercises like myofunctional exercise, where the patient is asked to touch the rugae for 5 minutes, and then other exercise like orthodontic elastics can be used. Then sugarless fruit can be given to the patient, asked to hold at the tip of the tongue and touch to the palate. And
4S exercise,
which is spot, salivate, squeeze, swallow. The patient is asked to spot the correct position like behind the papilla, and then salivate, and then squeeze the toffee or the sugarless fruit, and then swallow of the saliva. Then other exercise like whistling, and then reciting from 60 to 69, and then yawning.
Then the last exercise is tug of war, where one end of the thread is held from the lip and the other end is held from the finger outside the oral cavity, and the lip will show the resistance by pulling the thread inside.
The lip will show the resistance. Then coming to the mechanotherapy, tongue crib and the oral screen can be used for the treatment of tongue thrusting.